Okay, we are now live. Brad Lavoie, 5.5 weeks out of rotator cuff surgery. No sling. I am still wearing it at night, so I do need a part-time to protect my arm. The sling, when it's on my arm rather, keeps me from abducting it like this, which would really hurt, or moving it, but during the day I'm in control, hopefully, of my movements. So, what I'd like to show you guys today, with 5.5 weeks out, I have now been okayed to start active motion, slightly. What's called active assisted motion. So before I was doing these, I was sort of swaying and letting it lubricate just by swaying my hips and not moving it. Now I'm actually able to start doing this very slowly and carefully. But I actually use the muscle in my deltoids especially to help move it around, so this way I can let the arm dangle, but I can move it on my own, which is a big step up from where I was. Now, one of the other exercises I have, and I really can't demonstrate it to you here, I'm also working my scapula muscles and my shoulder blades by pinching them together. I do 20 of them for 5 count each, so basically this is all it is. 1, 2, 3, 4, 5, and relax. 1, 2, 3, 4, 5, and relax. I do that for a set of 20. All of these I do 2 to 3 times a day. I'm also still using to exercise the bicep muscle with no weight, keeping the palm up. I'm doing this for sets of 10, and keeping the thumb up as well for sets of 10. But the one I'd like to show you briefly today is on the table. This is a stretching exercise. What I'm going to do, I'm going to lift my arm carefully onto the table. Now I'm going to bend forward at the waist. Until I get to the point where it starts to get tight. And I'm going to hold it for 30 seconds. Now, I need to hold it because this helps stretch the muscle, lubricate it, but it also, with a joint, I'm actively, even though I'm just leaning forward, I'm actively firing the rotator muscles just a little bit. Just enough so they're firing, but not enough so I'm going to do anything which is going to cause damage. And I'm going to come back. And what I would do that for a complete set of 5 of those for 30 seconds each. The last one I'm going to show you is I go to my side. And I carefully take my arm, and I'm going to put it back out at this angle. This is probably one of the more, not painful, but it's tighter this way. What I'm going to do is I'm going to reach, kind of crawl, and then I'm going to lean. And this is about as far as I can go because I'm starting to get almost pain, so I'm actually going to back off just a tiny bit. And I hold this for 30 seconds as well. This one is the hardest by far, but it's just a good stretch. I'm going to go back a little bit more because I didn't really limber up enough today. But again, you go as far as you can, but again, until you hit pain. Pain is bad. A little stretching or tightness, that's okay. Some of these exercises are easier than other ones. That is by far the hardest one for me right now. Reaching out straight is fine. Reaching to the side is going to take some time to work. But anyway, 5.5 weeks past, I'm probably about 20 to 25% healed. And as I get new exercises, I will show you. Thank you very much. Take care.